Innovate. Enable.
Hello and welcome to a brand new episode of CNBC-TV18 and Qualcomm present the 5G opportunity. Private 5G networks are on the cusp of taking off around the world. The concept of enterprise-owned and enterprise-focused cellular networks is quickly gaining popularity as the combination of the performance improvements of 5G networks and the control and security that enterprises need is potentially too good to pass up. IoT, IIoT, VoIP, and supporting a massive number of remote sites are just few of the hardships today's enterprise networks face. When it comes to the healthcare sector, private 5G can offer an integrated, controllable, organization-wide approach to networking. This allows healthcare organizations to evolve their network quickly and securely, without losing existing investments in technology or assets to deliver better communication to its staff and care its patients. Joining us now on the show is Shri R.S. Sharma, CEO of the National Health Authority, to speak on how the revolutionary use of 5G has the potential to transform how healthcare is delivered in India.
Thank you, Rima, and hello, friends. I would like to thank CNBC TV18 for inviting me to speak on the 5G opportunity. Having been the telecom regulator for nearly 5 years, telecom is one of the industries I am always passionate to talk about. As I am now driving the digitization in the health sector, I would like to focus my keynote today on the intersection of these two industries, on 5G opportunities in health. Owing to the foundational layer of Jan, Janadhan, Aadhaar and mobile, we have seen digitization reach the grassroots levels of our country, with young girls and boys watching movies on their smartphones in urban and rural areas alike. We have over 800 million internet connections in India, with one of the highest data consumption rates of 17 GB per user per month. It is with the advent of 4G technology and low-cost data that we have been able to achieve this feat. As we all know, 5G has got basically three important characteristics which distinguishes it from the earlier versions of technologies. The first is very high throughput, which means we can have terabytes of data being transmitted through the network. Second is that we have machine-to-machine communication. And the third is very low latency. All these three capabilities together create many potential use cases. This technology available in the hands of billion people will transform the way we do things. Moving on to the topic of healthcare in our country, I would first like to talk about the Ishmannbara digital mission, popularly known as ABDM. Under ABDM, we are building digital highways for health that will connect all the stakeholders, including citizens, health providers, and enablers, and policymakers. Verified registries and dedicated digital protocols for health would ensure interoperability and accessibility for all. Some of the key building blocks of ABDM include Aadhaar number or Ayushman Bharat Health Account number, which is a unique number assigned to each citizen to help them have a unique identity across all digital health systems in the country. The second one is verified registries, which include healthcare professional registries and health facility registry and drug registry. Personal health records or PHR are paperless records with federated storage for the creation of longitudinal health history of citizens that could be shared with their consent. Unified Health Interface or UHI is a digital health protocol to search, discover, book and avail various healthcare services, including telemedicine. Health Claims Exchange is a digital health protocol for seamless health insurance processing, connecting all the payers and providers. Internet connectivity would be crucial for various digital health services such as telemedicine and longitudinal health record sharing. However, to go a step further to allow healthcare services to be driven through technology remotely, 5G would play an instrumental role. The IoT or the Internet of Things would see a tectonic shift with the 5G technology, as it would allow a faster transmission of multiple gigabytes of data per second. Clubbed with IoT and augmented and virtual reality, a 5G internet network would extend the applications of digital health beyond telemedicine to secondary and tertiary care through real-time monitoring, remote diagnostics, and remote surgeries. Health monitoring through connected medical devices would generate real-time data about patients that providers can use to improve health outcomes. At scale, analytics applied to these massive volumes of patient data could lead to new or improved treatments. To improve diagnostic capabilities, 5G could increase access to essential data and expedite the process of identifying and treating certain conditions. This revolutionary use of 5G has the potential to transform how future healthcare is delivered, enabling crucial efficiencies and reducing the need for some patients to visit hospitals. 5G could meet data-intense millisecond latency requirements necessary for telesurgery, allowing doctors to remotely operate responsive and high-precision surgical robots. I recently saw some brilliant demo of augmented reality lenses that allowed healthcare professionals to juxtapose diagnostic imaging on patients in real time. Both explain medical diagnostic better and perform procedures with more accuracy. Hopefully, with COVID-19 in our hindsight, the health sector is rightly placed for a digital revolution. And the 5G technology couldn't have come in at a better time to make a lot of these much talked about innovations a reality at a scale. Sky is the limit for the applications of this 5G opportunity in health. With a democratized access to such a revolutionary technology, enabled by the digital public goods made available through ABDM, I believe the future of digital health is one filled with the endless possibilities. Thank you very much.
Regardless of the industry, the drive for digital transformation of operations and experience enabled by technologies like private 5G is in full force. The dedicated, extensible, enterprise-focused nature of private 5G network, providing control and lower cost, along with performance enhancements, is what will transform the industry. It's time for us to take a very short break, but stay tuned, as on the other side, we have a very interesting panel discussion lined up.